Maayong adlaw na tong tanan. If you had a shoulder injury or you just had a surgery on your shoulder, in this video I'm going to show you exercises on how to improve and rehabilitate that shoulder. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. If you had a shoulder injury, may it be a rotator cuff tear or a labrum tear, or you have dislocated your shoulder, you might want to see your doctor and ask what your options are. If your doctor says you need a surgery, come back to this video and do this exercise that I am going to show you in this video. And if your doctor says you might want to try therapy first, then this video should help you. If you are ready, let's get started. Like I said, if you have a shoulder injury, you really need to see your doctor first, okay? And just a fair warning, shoulder rehabilitation is painful. Go as close to your pain threshold as much as possible, and be consistent with your therapy, okay? So the first exercise is going to be Codman exercises. All right, so it is just arm swinging. So first we're going to just stand up, okay? Have support from your table or a chair. And then say for example, my injured shoulder will be my right shoulder, okay? So support with your left hand or left arm, and then bend from your hips or waist. Keep your back straight as much as possible, and you just swing your arm like this. So you're swinging your arm back and forth first, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. All right, next one will be side to side. This is still part of the Codman exercises, okay? So we're going side to side like this. All right, let's go 10 again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right, now we go circles. All right, so we go circles like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now there is a variation for the Codman exercises that I like to do. All right, let me move this table just a little bit and let me get the cane. Now if you don't have a cane, just get you maybe your broom or a long pole or your mop. All right, all you need to use is something that is long and you can hold, okay? So I like to use a cane. If you have a cane, use that cane. All right, so like the swinging, the arm swinging, we're going back and forth first, like this, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we go side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The good thing about this exercise is you're sitting down and you have no fear of falling. You are safe doing this. Okay, next and last one with a cane, we're going circles like you're stirring the pot. Okay, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is your Codman exercise and the variation of the Codman exercise. Okay, the next exercise for your shoulder rehabilitation will be table wiping. So we are sitting down on your kitchen table. or a big table, or where you have a big table, that will do, okay? So it is table wiping. We are going to go back and forth first. I like to use both hands. That way the good arm is guiding the bad arm, or the shoulder that has the injury. Okay, so table wiping, we go back and forth first, okay? And 1, 2, go as far as you can tolerate. 3, 4, 5, 6, 7, 8, 9, 10. All right, next one, we go side to side. I'd like to fold it again, but the injured arm will be at the bottom and then guides with a good arm. Okay, so we go side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we go circles. So again, guiding your injured arm with your good arm. We go circles. 1, 2, 3, big circles. 4, 5, 6, 7, 8, 9, 10. And that is table wiping. Okay, so the next exercise is bent rowing. All we need is a canned soup. This is not a sponsored video, but who knows? Somebody might sponsor. All right, so it's bent rowing, right? So we're just going to stand up this time, support yourself, bend from the hips, all right? And just imagine you pulling your pants up, all right? We are going to target the posterior deltoid, or the back portion of your shoulder this time, okay? So we don't need to pull very high like this. If this is all that you have, because that part of your shoulder is still weak, then that's all that you will get, okay? Don't force it, all right? So it's just like pulling up your pants, like this. Easy, just go easy. Don't go heavy yet, because that part of your shoulder is still very weak and sensitive. Now, if you go heavy immediately, the front portion of your shoulder might start hurting, okay? So we're going to do the bent rowing, okay? So like pulling up your pants, all right? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's bent rowing. And you should feel that at the back part of your shoulder. Okay, so the last exercise is going to target your rotator cuff muscles, the muscles that are connected to your shoulder blade. All right, so all we need is, again, a canned soup or any canned goods that you have in your kitchen cupboard, and rubber bands. I will show you the variation on how to use these items, okay? So internal rotation and external rotation. You should feel it here on your shoulder when you do this movement. Keep in mind to keep your elbow tucked in and don't move it. If you need to support that arm so it won't move, do that, okay? So internal and external rotation. Let's do 10 of those. 1, 2, be gentle. 3, 4, 5, 6, 7, 8, 9, 10. And that's internal and external rotation using a canned soup. Okay, so now we're going to use the rubber bands. I'll show you the variation for the rubber band. What I like to do is to put the rubber bands through my thumbs, and then I will keep my elbow tucked in, and then the resistance is coming from my good arm and the rubber band, of course, and we're going to go external rotation. Don't worry going very far. You can't go there yet because that will hurt your shoulder. And you only have limited movement there anyway. Internal rotation, you have a lot of movements there, okay? So let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's external rotation using the rubber bands. Alright, for internal rotation using the rubber bands, what I like to do is to put the rubber bands through my middle finger and my pointer finger. Alright, now my other arm crosses over below the injured arm, and you're going to move your injured arm in. Alright, so give it a little pull to give it resistance, and you're going to go in towards you. Alright, so this is internal rotation. Let's do 10. Alright, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's internal rotation using rubber bands. So there you go. Those are the exercises that you can do at home to rehabilitate your shoulder. Again, let me remind you, please see your doctor before you do these exercises. And I hope I was able to help you rehabilitate your shoulder. And if you find this video helpful, please click on that subscribe button and give it a thumbs up. If you have any comments or suggestions or questions, just type it down below. Alright? So remember, let's exercise our minds and our bodies so we get stronger together. Until next time, paalam!